Step. Scenario. On post-operative day 3, after hemicolectomy, the patient reports mild abdominal pain, left shoulder tip pain, and shortness of breath. You are asked to examine the patient. You have 6 minutes for examination and 3 minutes for discussion. Okay? Everyone bin Ahmed. Let me bin Ahmed, please.
شايفين ده؟
Yes. Let me bin you. Bin. Yes. Okay. Let me put the timer. 6 minutes start.
Everyone can see me clearly.
Yeah.
Hello, I am Dr. Ahmed Suga. I'm a surgical doctor working here. Can you confirm your name and age, please?
Hello, doctor. My name is Lee, and I am 55 years old.
Nice to meet you, Mr. Lee. Today I will examine your tummy. Examination include looking feeling and doing some special test. During examination, you need to expose your tummy and your chest. Is that okay with you? Are you happy to do it with me?
Yeah, that's fine,
Nice,
doctor.
nice, Mr. Lee. Examination include looking, feeling, and doing some special test. If you feel any pain during examination, please let me know. Okay?
Okay, doctor.
Do you need any cable in this examination, Mr. Lee?
No, I'm okay.
Okay. Now I will start by take a look for your tummy. Okay.
Mhm.
Okay. Nice, Mr. Lee. Now I will start by check your temperature. Okay.
Mhm.
Okay. Now I will press gently in your tummy. If you feel any pain, please let me know. Okay.
Of course.
Is there any area? Did you feel any pain in any area in your tummy?
Yeah, I have pain. Diffuse pain in my tummy.
Okay. I will start to press gently. If you feel any pain, let me know. Okay.
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 Doctor.
I am really sorry. I'm really
Feel
sorry, Mr.
pain.
Lee. I am really sorry, Mr. Lee. I'm really sorry, Mr. Lee. Do you want me to prescribe a painkiller for you?
No, no, thank you.
Okay. So because you are in severe pain, I will examine you by another way. Okay.
Okay.
Now, please, Mr. Lee, can you show me your eyes? Please
Mhm.
raise your eyes up. Okay. Okay. Now, Mr. Lee, can you open your mouth?
Mhm.
Put your tongue out.
Mhm.
Stick your tongue up. Okay. This is an oxygen, Mr. Lee. Please put it in your mouth. Okay.
Yeah, I put it in my mouth.
And this is a pulse oximeter. I will check your oxygen in your body.
Okay,
Okay.
thank you, doctor.
Okay. Now, Mr. Lee, I will uh, I will take a look for your chest. Okay.
Mhm.
Okay. Now, Mr. Lee, can you please put your hand like that?
Yeah, I put it.
Okay. Now I will I will listen to your chest. Okay.
Mhm.
Okay. Now, Mr. Lee, I just want to assess your chest. Please uh, take a deep breath and hold. Take a deep breath.
Mhm.
Okay. Again.
Mhm.
Okay, nice, Mr. Lee.
Mhm.
Now I will check your pulse, Mr. Lee.
Consider it done.
Okay. I want to check your blood pressure by this thermometer.
On the chart.
Okay. I um, I want to check your finger, please.
Mhm.
Okay, thank you. Okay. Now, Mr. Lee, uh, can you please raise your leg?
Okay, I read it.
Okay. Okay. Now. Certainly, I want to take a look for your leg from here. Okay. 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 Please, Mr. Lee, can you expose your leg and your groin, please?
I suppose it.
Okay. I want to take a look. Okay. Okay. Now, thank you, Mr. Lee. I want to help you to redress now. We
Okay.
have reached our end of an examination. I want to help you to read. Just, Mr. Lee, I want to, sorry, I want to check your um, your wound. Okay.
Skip it, please.
Okay. Thank you, Mr. Lee. We have reached our end of examination. Thank you. Please let me help you to redress. Okay.
Okay, help me, please.
Thank you, Mr. Lee, for your cooperation. I will discuss with my senior and come back to you. Okay.
You
I
have
want to
30
check
seconds.
okay. I want to check the chart of the patient, the news score. I
This
want
is
to
the
check.
chart. You can take it. What else?
Okay. I want to check any investigation.
All investigation in your hand, doctor.
Okay.
Can take a
Thank
look.
you. Thank
Ok-
you.
Okay, you have 10 seconds. So can you please summarize your case?
Okay, I'm present. I did clinic examination for Mr. Lee. For Mr. Lee, he has the patient was in severe pain, so I did CRISP examination for this patient. The patient has patient has
Your patient post-operatively, right? And he came to you
yes,
by shortness of breath.
yes, the patient
What did you find in the care of critical surgical patient after you did
okay,
it?
airway patent, and and in the and I give the patient oxygen. Okay, the breathing no respiratory rate normal. Okay, and on auscultation there no added sound and normal chest expansion
Okay, what
and
about the news chart?
patient oriented news card the news card the news score patient has patient is tachycardic and tachycardic and tachycardic
What about blood
low blood
pressure?
pressure low
Mhm.
blood pressure and also
So
oxygen.
that's enough, doctor. What's your diagnosis?
My diagnosis is anastomotic leak due to surgery.
And what other differential diagnosis of abdominal pain?
Subphrenic abscess and subphrenic abscess and also subphrenic abscess and
Okay, what's the differential diagnosis of shortness of breath?
peritonitis. The difference diagnosis shortness of breath, pulmonary embolism, and diaphragmatic irritation from the anastomotic leak.
Mhm. And reason for shoulder tip pain?
Due to diaphragmatic irritation, because the diaphragm is innervated by C3 to C5, which is the same dermatome of shoulder.
Okay. And what's your investigation and treatment for this patient?
Investigation, I will do blood investigation for this patient, CBC,
Time up, but continue.
CBC, urine electrolyte, and abdominal ultrasound, abdominal X-ray, CT abdomen stable contrast, and abdomen stable contrast.
What type of abdominal X-ray you will request?
abdomen, rectal supine abdominal X-ray.
Okay. And what's your treatment?
I will manage this patient according to care of critical surgical patient. I will I will according to the care of critical surgical patient, and I will reassess the patient, and also I will reassess the patient, and also I will give the patient IV fluid and antibiotic and IV fluid antibiotic and arrange uh, uh, real laparotomy for the patient.
Mhm. But what other regarding surgical intervention?
Surgical intervention, laparotomy of the patient, real laparotomy to the patient, and heart mount procedure with with end colostomy,
And
a heart mount procedure with end colostomy, and
this patient has peritonitis. He will do peritoneal
resection,
lavage and draining.
peritoneal level drainage.
This is the last question. This station, Hassan. Let me review from the beginning. Ali, can
Ahmed,
I start or would like to start?
Ahmed, you said Hassan Muhammad. Ahmed. His name
Ahmed.
is Ahmed.
Sorry.
Yes, start.
Okay, Ahmed, very nice presentation. Let's review from the beginning. I'm so happy that you showed me that you will start by tummy and chest examination, not the care of critical and surgical patient. Then you shift immediately to the CRISP. You started by check the eyes. Am I right?
Yes,
Why?
I
Eyes related to the circulation more than airway.
yes I
So
was so confused that I
yeah,
just
yeah.
remember it, and I try to not omit it in the
Okay, no,
examination.
no problem. So you should start by airway by check the trachea central, and
Mm.
then ask the patient to introduce his tongue as you did, and offer a oxygen mask and pulse oximetry. Very nice. Regarding the breathing, also you check it by check the respiratory rate and chest movement, and then you shift to the circulation. In circulation, Ahmed, for mark, let me add Hassan, please. Okay, for mark of professionalism, you need to sculptate for chest, for heart, and for tummy. You did for
Mm.
chest and for heart. I think
Okay.
you did for chest only.
Yes.
Yeah, at the same time you should did for uh heart and tongue. Regarding also you skip the neck veins, one of the circulation, and also you skip in circulation the two bore wide cannula. I
Yes.
need to insert two bore wide cannula. And regarding disability and exogogia, did you ask the patient if he have pain in his calf so you can squeeze it to exclude pulmonary embolism?
No. I
Yeah, it
haven't.
is important because this patient is crisp. It could be pulmonary embolism. It could be anastomotic leak because it is
Okay.
post-operative. Regarding the but you did all the other principle of the examination. Regarding the presentation, you need to manage this presentation. I think you forgot what's the main problem, and I guide you to start with airway and then breathing and circulation.
Yes.
Just go quickly through ABCD. What did you find in airway and breathing in circulation and the chart? Regarding the differential diagnosis, you answered correct. Other differential diagnosis, you took a time to answer. I don't know why. Abdominal pain can be anastomotic leak, subphrenic abscess, mesenteric ischemia, intestinal obstruction. Any cause of abdominal pain, you can mention it. Differential diagnosis also, you answer just pulmonary embolism and MI, I think, and acute respiratory. No, you didn't mention acute respiratory distress syndrome.
Mm.
Uh, Otherwise, regarding investigation, you divide your answer. Very nice. Blood and imaging. And regarding the management, I am so happy that you mentioned I will treat this patient according to the care of critical surgical patient, starting by ABCD approach. But you forget to mention nearby mounts, urinary catheter, and HDU, and
Yes.
antibiotic. You need just to review this presentation and discussion, Ahmed.
I didn't review this station
Yeah.
recently.
I know we attacked you to do this first station,
Yes.
but you will be as the same as the exam. But otherwise, you did very nice. Ali, you can start.
Yes, good, Ahmed. Very good. That's a good presentation. I just want to add a couple of points for what Muhammad said. So if you're already not prepared for the station, that means you did a good performance. You said, did you feel any pain instead of do you feel any pain? Before you touch your patient, it's not did you feel any pain, it's do you feel any pain. During your presentation, during your examination, you lost your energy. You became a bit depressive and like you became upset. You should always contain your emotion while you're doing your station. Don't lose the energy. Don't think I messed up the station. Continue till the end with the same level of energy.
Okay.
I'm glad you mentioned that you're going to check the wound. That's very important, especially from surgical point of view. Muhammad said you skip it. Usually that's what's going to happen on the exam, but you should make it very obvious. You want to check the wound. You said the patient was severe pain. You should say the patient is in severe pain. He's still in severe pain. The rest of the point, Muhammad already mentioned them. You also need to say it faster, Ahmed. Like
try to train about the presentation.
Yes, especially the presentation. Try to record it and listen to yourself. Otherwise, I have no point. Muhammad, we can move to the next. Good, Ahmed. That's a good one.
Yeah.
Fatah Rahman asked a question in the. We're going to discuss the question at the end. Let's move to the next.
So the next question, same the session, which is pulmonary embolism, CRISP. Ala, please unmute yourself. All Hassan.
Yes.
Hassan, I think Muhammad.
Okay. Ala, let us start with Hassan, then we can practice with you. Hassan.
Yes.
Okay. Scenario: on post-operative day 8, after a hip joint replacement, the patient reports severe chest pain and shortness of breath. You are asked to examine the patient. Everyone, please be Hassan.
Okay.
Hassan. You have 6 minutes for examination and 3 minutes for a discussion. Okay. Adjust your camera. Or your patient. Okay, no problem. This is your patient. Okay, let me put the timer. 6 minutes started.
Can you hear me? My sound is good.
Yeah, raise your voice again.
Okay, just 1 minute. Okay. Hello.
Hello,
I'm
doctor.
Dr. Hassan. Hello, I'm Dr. Hassan. I'm one of the surgical doctor. May I confirm your name and age, please?
My name is Khan, and I am 35 years old.
Nice to meet you, Mr. Khalid. Today I have been asked to examine your chest and your chest that include look, feel, and do some special tests. Is that okay with you?
Yeah, but doctor, my name is Khan, not Khalid.
Khan, okay. Sorry for that.
No problem.
Nice to meet you, Mr. Khan.
Nice to meet you.
That includes, so I want to do some, we'll do some tests that include look, feel, and we need to expose your chest. Is that okay with you?
Yeah, that's fine, doctor.
Okay. Yes, do you need any problem during examination?
No.
Okay, so Mr. Khan, if you feel any pain during examination, please let me know.
Of course, doctor. Thank you.
Okay. Okay, now I want to assess your chest. If you feel any pain, please let me. Yeah. Yeah, you mean?
I feel pain.
Oh, sorry, Mr. Khan. I'm so sorry. Do you want some painkiller?
Yeah, it will be fine.
Okay,
Yeah,
sister,
doctor,
please.
I'm in severe pain. I also in a severe shortness of breath. I don't know what are you doing, man.
Okay, sorry.
I'm not able to breathe.
Sorry, Mr. Khan. I will assess you in different way. Is that okay?
Yeah, that's fine,
Sister,
doctor.
please give me some painkiller and oxygen mask. Okay.
Yes.
Okay. I will put oxygen mask. Now, Mr. Khan, can you open your mouth?
Yeah. On my mouth.
Okay. Can you elevate your tongue?
I elevated.
Okay, now Mr. Khan, I want you to, sister, can you bring pulse oximeter?
Yeah, this is a pulse oximeter.
Okay, thank you. Thank you, sister. Okay, now, Mr. Khan, can you put your hand like this?
Yeah, I did.
And okay, I want to see your test, okay?
Okay.
Okay, from now I want to see from here. Just take deep breaths.
I took it.
Okay, now, okay, thank you, Mr. Khan. Now I will gently press in your neck, okay?
Okay.
Okay. Thank you, Mr. Khan. Mr. Khan, now I want you to take deep breaths.
Of course. I took it.
Okay. Again.
Mm-hmm.
Okay, again.
Uh-huh.
Okay, thank you, Mr. Khan. Now I am going to gently press in your tap in your chest. Is that okay?
Okay.
Okay. If you feel any pain, please let me know, okay? Yes, thank you, Mr. Khan. Now I'm just, I want to go to, or I want to hear your chest sound. Is that okay?
Yes.
Okay. Thank you, Mr. Khan. Now I want to check your pulse. Okay.
Okay.
Okay, thank you. And I want to check blood pressure by sphygmomanometer.
On the chart.
Okay, sister, I need 2 pore cannula and IV fluid.
Consider
Please.
it done.
Okay, now, Mr. Khan, I want you to elevate your leg.
Okay, I did.
Okay, now the other one.
I did.
Please, can you expose your leg?
Yes, I did.
Okay, now I will elevate it and I will want to see below it. Okay, I elevate it. Okay, thank you. Now I am gently press in your calf.
I have severe pain, doctor.
Sorry, I will stop.
I can't tolerate it. I can't tolerate it. But be gentle, please.
Okay, I'm so sorry. I will stop. I will not complete this examination. I want only to check your surgical site.
Okay.
Is that okay?
Yes, check it.
Okay. Thank you. Thank you, Mr. Khan. I finished my examination. Now I want to cover you.
Okay.
Let me help you to cover you. Okay.
Thank you so much, doctor.
Thank you.
You have 50 seconds.
Okay. I don't want to add anything.
Okay. Could you please present your case?
Yes, I want to present. I have Mr. Khan, 55 years old, complaining of shortness of breath and chest pain. On examination, there is we consider this patient as on examination normal air entry, normal percussion, and trachea is central. And there is thoracoabdominal chest movement.
Okay, what's your main differential diagnosis?
My main differential diagnosis, most likely it is PE or pulmonary embolism. Other differential diagnosis can be chest infection, can be such as pneumonia, it can be acute MI, it can be ARDS or atelectasis.
Okay, and what is the investigation would you arrange? Okay,
I will do lab investigation, such as we will do lab investigation and imaging. We do lab investigation, full blood count and blood urea and creatine, and inflammatory markers, CRP and ESR. And imaging, we do and D-dimer. And imaging, we will do ECG and chest X-ray, and the gold standard for PE is CTPA.
What
or
other blood
CT
investigation you will consider? What other blood investigation?
and arterial blood gases.
Okay. And ECG finding associated with pulmonary embolism, can you mention?
Yes, we can find side to S1 and Q3, T3. We can find also right axis deviation and sinus tachycardia.
Prevention of pulmonary embolism. How to prevent pulmonary embolism?
Yes, we can prevent pulmonary embolism by conservative, by early mobilization and good hydration, and by pharmacological prophylaxis by giving low molecular weight heparin, or by mechanical prophylaxis by giving, or by good dead stock.
Okay, what's the treatment of pulmonary embolism, doctor?
Yes, if this consider, we can consider according to the severity. If it is mild or small BE, we can consider low molecular weight heparin, bridging by warfarin. And if it is severe pulmonary embolism, we can go for thrombolysis and surgical or interventional radiology embolectomy, or transcatheter, I think, or transcatheter pulmonary embolectomy.
Can you mention the dosing for anticoagulants?
Yes, for the dose for anticoagulant, we have the low molecular weight, for prophylaxis, low molecular weight heparin, we can give 40 milligram once daily, subcutaneously, and for management of for BE, we can give about 1 gram per kilogram BID, or twice daily, and for
1 gram or 1 milligram?
1 gram. I found it in school like this.
Okay, this is a low molecular weight heparin.
1 milligram should be.
It's 1 milligram per kilogram. It's 1 milligram per kilogram.
Yeah. Yes, I found you should.
No. I see it now on the school. It's 1 milligram per kilogram twice daily.
Yeah.
Okay, 1 milligram per kilogram twice daily. Okay.
What about unfractionated heparin?
Unfractionated heparin, we can give for prophylaxis 5,000 international units once per day, and for treatment we should give 80 international units per kilogram per hour. This is the loading dose. The maintenance dose should be 18 international units per kilogram per hour until ABTT 40 to 60 seconds. That is all.
Yeah. Emergency protocol if pulmonary embolism suspected in theater.
Yes, in theater we should activate emergency crash car, and then we prepare the patient for interventional radiology or for CTPA, and for management of pulmonary embolism.
Okay, this last question. This station, very nice presentation. Hassan, Ali?
Yeah, Muhammad, I just wanna quickly, that's very nice, Hassan. I think you're already very upside down, right, left. Your patient will be screaming in pain. That's why you will know, and he will do this as short of breath. You immediately start what you did. You change your approach and you put the oxygen and everything. You said, now at the end, you said, now I want to cover you. You can say, do you want me to help you redress? Or now I can redress your clothes. It's not cover you. It's not wrong, but it's not the perfect sentence. The dose, the discussion was brilliant, and the dose is 1 milligram per kilogram twice daily for the enoxaparin, or prophylactically 40 milligram once daily. For unfractionated heparin, is 500 international subcutaneously, and then that's a prophylactic one. Therapeutic 80 international unit per kilogram bolus plus 18 international unit per kilogram per hour. Your target is ABTT, and you should measure the ABTT every 6 hours. That's what we do here. And every hospital has a different protocol. You measure every 6 hours, and then you see if it's within the normal, If you have 3 reading within the normal, then you make it every day or whatever according. But you don't need to mention that on your answer. I don't have another point. I think even the grammar you were very perfect on it, Hassan. That's a huge improvement.
Okay.
Yes,
Hassan,
thank you.
very nice
Good job, and
presentation.
we match the clauses. The scrap, Muhammad. After this, after the meeting will finish in 6, you're gonna say your discussion. Before the next meeting, are you awake, everyone, or you're working tomorrow? What's your situation?
Me?
Yeah.
Yeah, I come from hospital.
Okay, Ala and Ahmed, you are willing to continue, right? We can
Yes,
split it
yes, no
into
problem.
2, half today and half tomorrow.
Yes, it's okay.
No
All
problem.
right. Muhammad, and now your discussion, Muhammad.
Okay, very nice presentation, Hassan. Hassan, I saw you wash your hand, but make it clear at the beginning. Regarding the
Yes.
patient, you forgot the inspection and looking. You start immediately by palpation. So,
Yes.
and make it clear also, as I see you in pain and shortness of breath, I will assess you in a different way. Make it clear. And regarding the palpation, also in the CRISP, you should check the apex for the heart. And regarding the collarbone, when you start percussion, you need to explain to patient because it is so harmful when you tap on the collarbone. And also regarding circulation, you did it very nice. You check the pulse rate and capillary fill time, but you forgot also to check the neck vein. I would like to look to your neck vein. I'm so happy that you stop your examination when I say I have pain in my calf. Excellent. Regarding the discussion, when I asked you what's the treatment, you forgot to mention, I will treat this patient according to the care of critical ill cervical patient. You immediately jump if it is non-massive and massive and so on. You should mention the CRISP at the beginning. I will treat this patient according to the care of critical ill cervical patient, starting by ABCD approach, then lab, as you said. Otherwise, I have no any point. Very nice presentation. Oh, Ahmed, there's a crucial point regarding
حسن
hormone.
محمد، وقت محمد الليله ما نايم ولا شنو حسن؟
Hassan. I said Hassan.
أنا
Okay.
قلت أحمد حتى.
Sorry. Hassan,
أيوة.
in pulmonary embolism, we should examine the bag of the patient. You should mention it.
Okay.
The examiner will say, of course, skip it, but you should mention it. Crucial point to mention the bag. Because chest examination, we will check it in front and from the back, okay? Otherwise, I have no point. Very nice presentation.
Okay.
So we will finish this meeting and we will create another meeting, Ali.
Mr.
Yes,
Muhammad, just
Muhammad.
about percussion.
أيوة.
Yes.
Is it necessary to do percussion in pulmonary embolism or omit because I said I saw in
the ideal thing you should say to the patient, I will tap on your chest, maybe a little bit uncomfortable. If you can tolerate it, I can do it. The examiner will say to you, skip it, because patient with pulmonary embolism, you cannot tap on his chest.
Okay.
But you should make it clear for the examiner. Okay, so we will
Muhammad, create the second meeting and start immediately. I will be joining in 2-3 minutes.
Okay.
When you are ready. But don't create it now. We'll give you like 2 minutes, okay? Or 3 minutes.
Okay.
All right. See you in a bit.